Well, Valentine's Day is not the only day in February to celebrate your heart. This month is also American Heart Month, serving as a reminder for local residents to be aware of important heart-related conditions and to be proactive to protect their heart. And to help us with that, we're joined today by Dr. Ryan Cooley from Aurora Advanced Healthcare. Thanks so much for joining us, Doctor.
Thanks for having me.
So, pacemakers, that's something that, of course, is related to the heart. Tell us a little bit about who would need a pacemaker.
Almost all pacemakers are put in for slow heart beating, which is called bradycardia. The normal resting heart rate is about 50 to 70. So anything less than that may result in a situation where there's not enough blood being moved around to the brain or other organs in the body, and therefore symptoms may arise. Some of the common symptoms are dizziness, fainting, exercise intolerance, shortness of breath, to name just a few.
And a lot of people have pacemakers. Are more people having pacemakers put in, or is it kind of been steady?
The numbers are on the rise. There's 3 million people right now worldwide with pacemakers, and about 600,000 are implanted every year.
And one of the most amazing developments is the MRI pacemaker connection. Talk about that a little bit.
Yeah, for many, many years, for as long as pacemakers have been around, patients with a pacemaker have been denied an MRI because of fears of compromising patient safety. So the MRI scanners have very strong magnetic and radio frequency fields that can do two potential things. That one would be heating the lead, which may heat the tissue. And then secondly, there may be unintended cardiac stimulation, which could cause an arrhythmia. And third, these strong fields may actually functionally disturb the electronics of the pacemaker. So now Medtronic has come up with a technology called SureScan that makes their pacemaker FDA approved and can be imaged with MRI scanners any part of the body. And this has been a great development for these patients. Now they can have MRI scanning.
Right, so people with a pacemaker can get an MRI. Is that saving people's lives?
You know, MRIs are an incredibly powerful diagnostic tool. So physicians use MRIs to scan any part of the body to aid in diagnosing medical disorders. Cancer, stroke, brain disorders like dementia, bone and joint problems. All these things are analyzed and assessed by MRI scanners. So not having the capacity to reap the benefits of that technology has been, you know, a sore point with pacemaker patients.
Well, fantastic, because of course that's just an amazing development to be able to get an MRI when you have a pacemaker. So, Doctor, thanks so much for joining us and sharing that information.
You're welcome.
And if you want to get any more information on that, you can go to Join the Pacemakers. We have a link on our website at tmj4.com.